Alright, so we're now coming over to the first topic in PCL 351, which is Introduction to Pharmacology. So we're going to be beginning with the basics, definition of pharmacology. What is pharmacology? So pharmacology actually came from two Greek words, and the two Greek words are pharmakon and logos. So pharmakon is the Greek word for drug, drug or remedy. So pharmakon is the Greek word which means drug or remedy, while logos refers to study or science. So pharmakon refers to drugs or remedy, while logos refers to study or science. So looking at these two things, pharmakon, logos, that's pharmacology. That is like the study of drugs. So basically what pharmacology is about is the study of drugs. So there are a lot of definitions you have for pharmacology. A lot of any textbook you open, you see its own definition of pharmacology. So but basically pharmacology is the study of drugs. So this definition can work for us. So pharmacology is the branch of science concerned with the study of drugs and their effects on living systems. So pharmacology is the branch of science concerned with the study of drugs and their effect on living systems. So depending on what your lecturer is teaching you with, you can use their definition for the examination. So but this is also a standard definition of pharmacology that you can able to work with and it will give you your marks the way it's supposed to give to you, because pharmacology is concerned with the study of drugs and their effects on living systems. So pharmacology bridges basic science and clinical science. So basic science refers to chemistry, physiology, biochemistry, and then clinical sciences refers to medicine and therapeutics. So pharmacology combines principles or integrates together basic sciences, that's the chemistry, physiology, biochemistry, together with clinical pharmacy, that's medicine, therapeutics, so that you can be able to understand drugs and then their effects on living systems. So drugs on the own, understanding it, you need to understand chemistry, living system, physiology, biochemistry, chemistry as it relates to the biological system. Medicine and therapeutics has to use this drug, to affect the kind of effect you want to do, maybe treating, preventing, or running the diagnosis for anything. So there are actually two types of pharmacology we need to look at. We look at basic pharmacology and we look at medical pharmacology. So basic pharmacology focuses on the fundamental principles of drug action. So basic pharmacology, from the word basic, it just says that this is like fundamental, this is like the normal or the basic thing you need to know, the foundation. Yeah, I think that's the word, foundation. So focus on the fundamental principles of drug action, including the molecular mechanisms and biological processes that drugs influence. So that is basic pharmacology. So medical pharmacology specifically now involves the study of drugs that are used to prevent, diagnose, and treat diseases in humans. So while basic pharmacology just studies, the fundamental principles of drug action, the molecular mechanism for drug acting, and the biological processes by which, drugs exert their influence, or the things that the biological processes that drugs influence themselves. Medical pharmacology focuses on the study of the drugs that are used for the prevention, drugs that are used for the prevention, diagnosis, and treatment of diseases in humans, basically. So that is basically that about basic and medical pharmacology. I hope you understand the distinction between these two. So then moving forward, a drug, what is a drug? A drug is any chemical substance other than food. A drug is any chemical substance other than food that when introduced into the body produces a change in biological function. So this is a very key word here, a change. So a drug is a chemical substance other than food that when introduced into the body produces a change in biological function by interacting with living systems. So that produces a change in biological function by interacting with living systems. We are going to talk about drugs in details subsequently after this particular lecture. We're going to look at the drugs, we're going to look at the sources of drugs, both plant, animal, recombinant DNA technology based, and all of that. So we're going to be looking at that very quickly. So but this is what a drug is. A drug is a chemical substance, any chemical substance other than food, because food is also a chemical substance. So anything other than food that when introduced into the body produces a change in biological function by interacting with living systems. So let's look at the scope and subdivisions of pharmacology. So pharmacology has two main areas of pharmacology are pharmacodynamics and pharmacokinetics. So when we talk about pharmacology, there are two things we want to answer. there are two things we want to answer. First thing we want to answer is, what does the drug do to the body? First thing we want to answer. And second thing we want to answer is, what does the body do to the drug? I don't know if that's making sense to you. So there are two things we are looking at here. We are looking at drug and we are looking at the body. So in pharmacology, we are looking at what does the drug do to the body, and we're looking at what does the body do to the drug. Now, what the drug does to the body is what we refer to as pharmacodynamics. And what the body does to the drug, or how the body interacts with the drug, is what we refer to as pharmacokinetics. Take note of the distinction. What the drug does to the body is pharmacodynamics. What the body does to the drug is pharmacokinetics. Drug to the body, dynamics. Body to the drug, kinetics. So that is basically, in fact, you want to remember it when you say what the drug does to the body. Drug, D, dynamics. Is that making sense to you? So that can actually help you to recall that. But as you progress in pharmacy school, it will be easier. So what the drug does to the body, D, drug, pharmacodynamics. What the body does to the drug is what we refer to as pharmacokinetics. So more clinical definition, pharmacodynamics studies the effects of a drug. Are you seeing that? On biological systems. Effect of drug on biological system. Drug on the body. That's biological systems. So it has to do with the molecular, biochemical, and physiological effects of drugs, including drug mechanism of action. Basically, pharmacodynamics is covering the effects of drugs and how these effects are exerted. So pharmacodynamics can be defined as the molecular, biochemical, and physiological effects, study of the molecular, biochemical, and physiolocal effects of drug, including the drug mechanism of action. So the drug mechanism of action refers to how these drugs exert their effects, basically. So what about pharmacokinetics? Pharmacokinetics studies the effect of biological systems on drug. What I talk about, the body on drugs. So pharmacokinetics studies the effect of biological systems on a drug. So what the question that pharmacokinetics answer is what the body does to the drugs, while the question that pharmacodynamics answers is what the drug does to the body. I hope these are making sense to you. So we're going to be going into details to discuss pharmacodynamics and also to discuss pharmacokinetics. Pharmacodynamics, what the drug does to biological system or the body, and then pharmacokinetics, what the body does to the drug or what the biological system does to the drug. Now, pharmacokinetics actually has 4 key areas, which is represented by the acronym ADME. So ADME, let us now talk about what is ADME. So ADME is absorption, distribution, metabolism, and excretion. All right, so that is ADME. So absorption, distribution, metabolism, and excretion. Absorption has to do with how the drug is absorbed into the body. Distribution, how it is distributed from the site of absorption. Metabolism is also what we refer to as biotransformation, how this drug is metabolized or transformed from one form to another in the body. And excretion now refers to how it is removed from the body, how the drug exits the body. So many times, some persons have a problem with interpreting the E. Some persons say the E is excretion, some other persons say the E is elimination. So, but on a broad level or on a scientific level, basically, metabolism and excretion are usually classified under elimination, because usually why I use the word usually is because not all metabolism leads to like the elimination of the drug. So when drugs are metabolized, many times that is the beginning phase of the elimination of the drugs from the body, because some of drugs, when you metabolize them, it becomes inactivated. It means the drug is no longer useful in the body, and then excretion now has to do with the exit of the drug basically from the body. So usually both of them usually come under elimination. So but for some lecturers, they could tell you that E is excretion, some other lecturers E elimination, but basically both metabolism and excretion falls under elimination. So, and as we go further, we're going to look at that very quickly. So subdivisions and branches of pharmacology. So the subdivisions and branches of pharmacology, we have pharmacokinetics, we talked about it, what the body does to the drug. Pharmacodynamics, we talked about it, what the drug does to the body. Chemotherapy has to do with the use of chemical substances in treating of ailments, infectious diseases or cancer-based diseases. So in chemotherapy, you are looking at antibiotics, you are looking at antiprotozoals, you are looking at anti-cancer drugs and the like. So that's what we refer to as chemotherapy. Chemicals in therapy. Is that making sense to you? All right, then clinical pharmacology or therapeutics is now talking about using of pharmacological principles in the treatment and taking care of patients. Then pharmacognosy has to do with drugs, use of drugs that come from natural origins, and natural origins in this context refers to drugs from plants, minerals, and animal sources. I hope that's making sense to you. So it's a branch of pharmacy on its own. By now you should already know what pharmacognosy is. Toxicology is another aspect of pharmacology. In most pharmacy schools, pharmacology departments also combine with toxicology. So you have departments of pharmacology and toxicology in most pharmacy schools. So toxicology has to do with the harmful effects, study of the harmful effects of drugs. Now there's a man called Paracelsus. Now, there's a man called Paracelsus. Paracelsus talked about the fact that every drug is a poison. The difference is the dose. So every drug is a poison. The difference is in the dose. So if the dose goes to certain degrees, it now becomes like poisonous or harmful to the human body. So every drug is a poison, but the difference is in the dose. It was stipulated by Paracelsus. You can always look it up to understand that or find out more details about it. So toxicology has to do with the harmful effect of drugs, studying that, and there are different branches of toxicology. In your higher levels in pharmacy school, there's a course basically for toxicology that has to do with poisons and the likes. Then pharmacogenetics or pharmacogenomics. So pharmacogenetics or pharmacogenomics, that has to do with studying of drugs as it relates to individualized persons or to persons as individuals. So there's a way individuals respond to drug differently. I don't know if you're getting it out. So different individuals respond to drug differently. So a particular medication on one person may work very effectively. On another person, that medication could cause maybe an allergic reaction, or it may not work. That means it could be that maybe the dose for that particular person is not up to the therapeutic dose for that individual due to some genetic factors. So the study of how drugs work on individual levels, as individuals, is what we have this pharmacogenetics, or what we call pharmacogenomics. It's a branch or a field in pharmacology. The neuropharmacology has to do with study of drugs that affect the nervous system. That's the neurons, nervous system. So molecular pharmacology has to do with the study of drugs and how they work on the cellular and the molecular level. That is molecular pharmacology. Veterinary pharmacology has to do with study of drugs that are used in animal. So that is veterinary. That's veterinary pharmacology. Then environmental pharmacology has to do with study of pollutants, how drugs affects the environment and all of that. That is for environmental pharmacology. Systems pharmacology, how drugs interact with pharmacological systems as a whole, or physiological systems as a whole, basically. So the in systems pharmacology, that's how to talk about different systems and then how drugs interact with these different systems. So the respiratory system, the nervous system, the cardiovascular system. Then the pharmacoepidemiology has to do with the study of drug use in a population. So epidemiology has to do with disease pattern. The pharmaco, that's drug use in the population with regards to a specific disease pattern. It's a topic on its own in pharmacology. You're going to be seeing that as you go on. Comparative pharmacology has to do with pharmacology that has to compare some variables basically, and then pharmacoeconomics has to do with the economic perspective, bringing it to the drug aspects. Basically, this is more under clinical pharmacy. You find this pharmacoeconomics featuring more under the clinical pharmacy department. So these are different subdivisions or branches that are obtainable in pharmacology. So let us now make progress and talk about drugs and their sources, and then we'll move over to the next topic.